our utilization for hospitals are still very low for COVID-19. So hindi pa tayo tumataas. Although I'm watching the events unfold in Singapore, because I think in Singapore has reported an increase in FLiRT, not flirtations, but FLiRT, the new variant of variant under monitoring. It's a variant under monitoring. So hindi siya variant of concern, variant under monitoring. And tumataas sila doon. They reported an increase in cases. It's filling up their hospitals. So we're watching ours. We still don't have that number. We're asking our doctors and hospitals to report antigen testing. Because ngayon, the testing is not PCR na. Diba? Rapid antigen na. So we're asking our doctors to report that to our epidemiology bureau. The one we're monitoring really is ILI, or influenza-like illnesses, of which COVID-19 is one of those, right? So we monitor that. Luckily, even the one in Singapore is mostly respiratory tract infection, ubo-sipon, common cold. So I'm not thinking border control, mandatory mask. I'm not thinking that. But I'm advising every Filipino, since that's happening, that can come here, yung minimum public health standards. If you are sick, you have cough, colds, sore throat, it's better to stay home. If you need to go out, wear a mask. So it's still personal. No requirement for border control, no requirement for mandatory mask, no requirement for additional vaccination. But we're monitoring the cases.
Sir, is it possible na itong strain na to or yung variant na to is also present here in the Philippines? And could you tell us more about this
Yes,
strain?
it's possible. Although the variant isn't serious, that's why it's only classified as a variant under monitoring.
Do we have now scientific basis for travel restrictions to any country? Kasi hindi lang naman Singapore, may India din. So do we have now the scientific basis for that, for the restrictions po or travel ban? In any case?
No. As I said,
At
border
least para
control.
klaro lang sana.
Yeah,
sir.
para klaro, no? Border control. The Bureau of Quarantine is of course continuing to monitor this. Remember, may declaration form ka when you enter the Philippines. Pero online nga, yung e-travel, di ba, dinideclare mo yun kung may symptoms ka. So, binabantayan niya ng ating Bureau of Quarantine, which is under the Department of Health. So, we will have that data kung marami tayong turistang pumapasok na may respiratory symptoms and fever. But I will not recommend any border control. That means banning travel or whatever to Singapore or to India. The caution is precaution mo. You must be vaccinated at least, or if you're at risk, probably I'd advise don't travel there muna while they're having increasing number of new cases. Pero if you're healthy, maybe a regular mask that you bring along to protect you would be a good advice.
Jean Mangaluz, Inquirer.net.
Hi, good afternoon, Secretary. Is the government mulling a lower deployment cap for nurses amid the 190,000 gap?
No. In fact, if you have a good product, like a nice car or a nice TV that is being exported and is in demand, would you stop its production? No. I will just increase more. And that's where the direction we're going. Since our nurses are in demand, that means we're producing good nurses. What does that mean? We also get good nurses when you get sick in the hospital because they're export quality. So that means to me, I'll just produce more nurses. So the idea is the SUCs have started with the medical schools, but we're still trying to produce more SUCs with more nursing graduates. So para mag-increase din tayo ng nursing supply in the Philippines. So I'll increase the supply if the demand is high, not put a cap on it.